Alternative therapies for respiratory disease, lung diseases. Um, I can cite some studies on asthma in particular. Back, oh my gosh, this has to be early 90s. There was actually a study published in the New England Journal that compared chiropractic medicine with standard asthma treatment, coordinated out of McMaster University in Hamilton, Ontario, Canada. And it actually showed that chiropractic did not help the patients with asthma. That's the only well done study that I'm aware of. I am aware of not peer reviewed literature that advocates, meaning it hasn't been, the study hasn't been vetted by so called experts in the field, of alternative treatments for asthma. My preference is to let's put everything on the table. I hope parents will be forthcoming and honest in saying they've tried this and they've tried that. My usual response is, look, I don't see any harm in trying this, but please don't abandon proven therapies or substitute proven therapies for therapies that have not been proven. And I suppose the one treatment that I would be worried about is if the parent felt or was told to administer an oil-based substance orally, particularly in infants, because sometimes these breathing symptoms are actually due to aspiration, meaning liquids in particular, sometimes even solids, when they're swallowed, are not going down the esophagus or the food tube into the stomach. They're actually going down the windpipe or trachea into the lungs. And if parents think that, well, my child doesn't have signs or symptoms of aspiration, that's what it's called, aspiration, you're really potentially risking your child's lung health. And the reason is, we know silent aspiration exists. When you and I drink a cup of coffee and it goes down the wrong tube, we cough violently, the whole world knows, but infants can be silent. And I never cease to be amazed by studies where we have the child drink the contrast agent. It's an x-ray study, and you see it going down the trachea and the child doesn't cough. And it's really helpful for parents to be at least in the viewing room or see the video after, because they will see where the contrast material is going, and it's going into the lung and their child isn't reacting. And it just makes me stop and think, well, how often does it happen during a 24-hour day at home? So the point of the story is silent aspiration can occur, and if you're administering an oily residue or an oil-based homeopathic remedy to your child and it's getting down into the lungs, and remember, that may be the cause of their respiratory symptoms, this aspiration thing. Oily material in the lungs wreaks havoc. It can be literally hell for the child. It can cause severe respiratory disease, sometimes with permanent damage. So just be careful on that.